The communication skills encounter takes a total of 10 minutes and involves interaction between the candidate and a patient, actor, or an actor representing a relative. You are given 5 minutes before entering the station to read the scenario on which you will be tested. Use this time wisely and jot down the information to be conveyed and its hierarchy. The candidate must talk to the patient or relative about their concerns and try to allow time at the end to summarise, agree a plan, and also allow time for questions within the 10 minutes given. Try to somehow be aware of the time. This may be by looking at a clock within the examination room or having your own watch within eyeshot. It can be reassuring to know that there is plenty of time left. However, I would obviously caution against continually looking at the time, as this could be conveyed as poor interest in the matter at hand. A clear, bright introduction by stating your name and ascertaining the interviewee's name and the reason for the discussion is a good start. If speaking to a relative, establishing patient permission to discuss their case is imperative to preserving patient confidentiality, and this is something the examiners will look out for at the beginning of the encounter. If the scenario is breaking bad news, it is appropriate to ask if the person would like someone to be present with them. This can act as an initial warning shot. For most scenarios, you must ascertain what the patient or relative is aware of with regard to their case. This is best done by very open questions and actively listening with either encouraging nods or replies. Further probing questions may be needed. If the scenario is concerning a certain concern or disagreement, then the root of this must be identified, as it may be a simple misunderstanding that can be easily resolved. Pauses are very powerful in communication, and delivery of particular bad news may warrant an extended pause to see how the patient responds. Empathy should then ideally follow, and if the patient is very upset, then permission to continue or asking if they want a moment shows good empathy. If tissues are close to hand, then these could be utilised. As the scenario unfolds, it is important to realise that communication is a dynamic process, and the subject may raise various cues that will need at least an acknowledgement. It will look very unprofessional to ignore these, and the actors will be briefed to raise them a second time, but if not addressed, not a third time. Not all patients' concerns need to be addressed immediately, as the interview may become unstructured, but the skill is to acknowledge these cues and promise to address them later. Candidates often ask me about physical contact during breaking bad news, and this is a difficult one to address. This is the first time you have met this person, and some candidates may wish to place a hand on a subject's shoulder in a sign of empathy after delivering bad news. This will be governed by the candidate's individual personality, and certainly anything beyond this simple gesture would be frowned upon by the examiners. The spacing of the chairs should provide adequate personal space for both the candidate and the subject, and you should avoid pulling the chairs too close together to invade someone's personal space. It seems relatively obvious, but some candidates do use a lot of medical terminology to explain things to a patient. Some candidates also have a terrible habit of asking multiple questions, which can be more of a problem in the history-gathering areas of the PACES exam. But it is worth noting that people will only tend to answer the last question in a multiple question sequence. Rapport can relatively quickly be established with the subject by people who are naturally good at communication. A good tip would be to inquire a little more if someone's employment comes up. So if someone states that they are a teacher, this could be followed by which subject or age group do they teach. The candidate may say something like, "That must be a challenging job." And whilst not directly related to the scenario itself, this can put people at ease and demonstrates good communication. Humour, if appropriate, can also be similarly used in this context, and a short, light-hearted exchange may again demonstrate good people skills. The examiners will be assessing your ability to impart information in a clear, empathetic, and structured manner, but you will also be assessed on your ability to listen and respond to the information given by the patient. Basic or straightforward information should be given first and incrementally, building on a person's understanding. This should be summarised, and the subject should be asked if they need anything repeating or if anything important has been missed. This layered approach will ensure a better understanding and retention of information. The candidate should try and give the subject choices rather than instructions wherever possible. Some candidates feel they must tell the subject everything they know about a particular condition, which is certainly not the point of this station. A barrage of superfluous or confusing information is a sure way to fail. Your in-depth medical knowledge is not being tested, rather your ability to explain and reassure a patient's particular concerns. It is far better for the patient to have secured one or two key facts rather than have a jumbled blur of information.